It just lifts you out of that awful hell. You just can't believe it. You wake up and you just feel different altogether. You just, as I say, it's unbelievable. It's a relief.
In the great majority of patients with such symptoms, in perhaps 85% of such patients, there will be a rapid improvement within 2 to 3 weeks of the treatment. So it's a treatment that's well worth considering for such a severe illness. E.C.T is a safe and effective treatment for severe depressive illness. The other thing that's important to note is that it is usually a very fast treatment, bringing about a lot of recovery in 2 to 3 weeks, much quicker than antidepressant medication usually takes. For that reason, we may often suggest it very early on in a severe illness where the patient is so depressed and so slowed up that they're unable to eat or drink and clearly need to get better very quickly.
Well, I wasn't sleeping, wasn't eating very well. I couldn't communicate. I was very withdrawn. Life was just unbearable.
It's also very effective, usually, in depressions where the person loses touch with reality and is so depressed that they get very distressing voices and false beliefs. It's also important to consider it where the suicide risk is extremely high and the person needs to be brought through that phase very rapidly.
Well, I didn't want to live, for one thing, which was not a bit like me.
I mean, you get to a stage where you're in such a state within yourself that anything that you think is going to help you, you'll go for.
Well, it's helped me anyway, let's put it like that. I've improved greatly. And it's given me something to live for too, because before that I wasn't very keen on, I was very depressed, and so it's helped me tremendously.
But we also use E.C.T as a second-line treatment in those cases where the patient has failed to respond to adequate doses of antidepressant and similar medication, because quite a percentage of those people who've not responded will go on to get better with E.C.T, and that would be an important additional use of the treatment.
I must admit that I was concerned about the treatment, and but as my wife was willing to try anything to get her out of this depression, I gave her the go-ahead.
Well, I think the final decision would rest with the patient's consultant. But I think, as with all decisions in modern-day psychiatry, it's a decision that's made with the other doctors on the ward, the nurses, and the other professionals working with the patient. It's also, of course, wherever possible, discussed fully with the patient, provided the patient is well enough to do that. And, of course, it's also very important to get in the patient's next of kin or carers so that they can be fully involved in the decision.
Well, I mean, I was told that, explained to me that you just lay there on the couch and these sort of electrodes were placed on your temples and you were given a small injection. You became unconscious and the treatment was carried out, which only takes a very short time. And then you rest for a while, you wake up as right as ninepence.
It's usually given very early in the morning, at about 9 o'clock, and the patient will be taken into a waiting room and then into a treatment room where he or she will lie on a bed and, for example, things like dentures and other such equipment would be removed as in any other anaesthetic procedure. The patient's then given an intravenous injection by an anaesthetist of a general anaesthetic and they drift off to sleep. While the patient's asleep, and this procedure only takes a few minutes, a second injection of a muscle relaxant drug is given, so the patient's body is very relaxed indeed. At that stage, with the patient completely unconscious, a very transient dose of electricity is applied to the patient's temples, and this produces a very short seizure, which lasts perhaps 20 seconds, with some very minor movements of the arms and legs. A couple of minutes after that, the patient will wake up and they'll find themselves in a recovery room, and a nurse will be with them until they're fully recovered. Really, within 5 to 10 minutes of the treatment, the patient is then usually ambulant and having a cup of tea and a biscuit. They may have some slight memory impairment for that morning, and they may have a headache which can last a couple of hours, but that usually resolves to a couple of paracetamol. I think the media publicity creates a great deal of fear. I think the fact that we're not entirely sure how it works creates a sense of fear. And I guess any treatment that involves a general anaesthetic and the use of electricity is going to be seen as anxiety-provoking.
One thing I was very disappointed about, that there was no communication between nurses and the patients. You were just sort of left to your own devices. You didn't have anybody to ask you, how do you feel today? Or any words of encouragement. It doesn't do anything for your depression.
Well, I came out in a big bruise on my hand where they put the anaesthetic in.
Yes.
And I slept for half a day.
Uh-huh.
I couldn't seem to come round.
Right.
And I decided I didn't want any more.
I think a lot of it is the unknown. I think if they had a lot explained to them beforehand, I don't think that they would feel like that. I think if they were told, that the only thing about, having asked about E.C.T, had I got anything, the only thing I find, I prefer not to have the oxygen mask on until I'm asleep. But as far as everything else goes, we're just treated 100% because you have a cup of tea afterwards to recover, and as I say, actually a lunch is thrown in when it's dinner time, so I can't grumble, can I?
You don't really know anything about it. You're there and you get an injection, and the next thing you're unconscious, and after a while somebody wakes you up and that's it. You don't know.
I'm inclined to have a sleep afterwards. When I go home, my husband always says, do you want to go up to bed for a while? And I'll sometimes have a little nap, perhaps, but not really. It doesn't really affect me a lot. Might be a little bit giddy afterwards, but when you've had a cup of tea, it soon comes, you soon feel all right.
Well, you feel able to go about things and do things in the normal way, you felt that you could speak to people, that you felt happier, that you felt more yourself. You didn't feel that you were fed up and not being able to deal with anything.
It's helped me anyway, let's put it like that. I've improved greatly, and it's given me something to live for too, because before that I wasn't very keen on, I was very depressed, and so it's helped me tremendously.
Well, I'd say it was within 2 weeks she was back to her normal self.
Most definitely, I'd say to anybody, go for it, because it's really the answer. If you feel really depressed, it's the answer. It's a godsend.
E.C.T, as far as I'm concerned, is the one thing that can help.